Hi, I'm Heather, and I'm going to be performing trach care and suctioning. So first, I'm going to check the chart and see exactly what's ordered, and then I'm going to gather my supplies and the proper PPE I'll put on before that. Hand hygiene. Wash my hands. I'm going to come in. I'm going to introduce myself. I'm going to identify the patient, name, date of birth, check the wristband. I'm going to put the bed to a working level height. I put it to a 45-degree angle. And then I'm going to explain to him the procedure and what exactly is going to happen. He may not be able to respond because of the trach, so I'm going to say if he's in discomfort, if he needs something, he needs to stop, to raise his hand. And then I'm going to have, I connect this. I'm going to connect this now. If this was the right cords. This would be turned to 150. And then for the suction, and then for the oxygen, for the ambu bag, that would be about 10 to 15 liters of oxygen. So this would be connected to the cord up there. And then once that was all set, now that I have it connected, I would just check to make sure that it's actually working and coming out before I get my sterile gloves on. Same with the oxygen. I would make sure that's connected and working properly before I would get sterile as well. So everything's working well, so now I'm going to go take off these gloves, do hand hygiene, and I'm going to put the sterile gloves and get that set up. I'm also going to put this blanket on for him in case anything gets messy. I'm going to have this little cup for the sterile saline. I'm going to pour that in.
There's something to practice. I'm watching the video, like reading over the rules. Somebody should practice like as you read over this and not do something
Okay. I put these first. Dispose of this. Little tube in here. And this is going to connect to here. If it were the right tubing, this would connect, so we're just going to pretend. And then 2-3 inches of the tubing go in. I did not put my finger on the stopper for the suction. I let it loose until I'm in, and then as I pull out, I would twist a little bit and just intermittently suctioning for a few seconds, and then I could do that about 3 times. But before I did that all, I would have done that ambu bag, and then I would do that in between as well. And then after that, I'm going to go now for the second part of the sterile. I could remove the gauze, and I can remove this piece here, and we're going to replace this with a new one. Okay? And I'm going to dispose of these. Dispose of the sterile gloves. Hand hygiene. Also, I want to say before I went to suction, I should have went into the sterile saline to get it ready, to get it suction in the saline first, and then again to clean that out.
When I go back because I know there's some people that wanted to come to it, they had the same amount of treatment as me. You know what I'm saying?
I will dispose of this.
Well, I think these people get them out. Usually, other people just go out.
And then I would take the new part. I have a new sterile one here. But before that, I would take, I'm going to clean in quarters. And clean that and dispose. I get a new one and dispose. And then I go around each time disposing out to all 4 sections. Then I'm going to place the gauze underneath here. That was a brand new sterile one. Goes in here. Okay, and then now it doesn't have to be so sterile because that's covered. And then I'm going to change the I can change the collar if you needed that to be changed. If it got dirty, we could do that. And then once that's secure, then that would be good. And then I would lower the bed, have a call light there, and do hand hygiene. Thank you.